Introduction and overview. Constipation in children is very common. 1 in 3 children will suffer from it. But it's often not recognised, and even when it is, it's poorly managed. In order to be able to explain constipation to parents and children, we need to be able to explain to them how the bowel works. Something like this. The first thing to explain is that it's one long tube that goes all the way from the mouth to the anus, or back passage, the exit in your bottom. And it's a really long tube, about 10 metres long, the length of a double-decker bus. We all know that food goes in at the top and that poo comes out at the bottom, but what happens in between? As the food travels along the first part of the tube, the body is busy digesting it and absorbing all the good stuff. When it reaches the junction between the small bowel and the large bowel, or colon, all the goodness has been removed and it's just waste that continues on the journey. The poo at this stage is liquid. As it travels up the ascending colon, along the transverse colon and down the descending colon, the body absorbs water, so the poo changes from liquid to squishy to soft poo, ready to be passed. So how does the poo move along the tube? The whole of the colon is like a conveyor belt, with a bit of poo here and some more here and here and here. Muscular action, called peristalsis, moves the poo along, a bit at a time. Every time we have something to eat, it triggers a reflex which makes the conveyor belt move along a bit quicker. Therefore, the best time to sit on the toilet to try and do a poo is 20 to 30 minutes after eating, when the poo is moving quickly. But more about that later. If the poo spends too long on its journey, then too much water is absorbed, and the poo can become hard and dry and stuck. So how do we know when we need to do a poo so we can keep the conveyor belt moving and stop it getting stuck? When the poo has gone round the corner of the pelvic colon, it reaches the rectum. The rectum is made of smooth muscle. When the poo arrives, the rectum is stretched, and it's that action of stretching that sends a message to the brain telling us that we need to do a poo. We should really respond to the message straight away, but sometimes it's not convenient, so we postpone the poo until we can get to the toilet. The rectum stays stretched, with the poo waiting inside. The conveyor belt keeps moving, so before long some more poo arrives. The rectum is again stretched, and once again it is that action of stretching that sparks off the message to the brain. If we don't go to the toilet, the poo just sits there, and as the rectum is permanently stretched, no more messages are going to the brain. So it's easy to forget that we ever needed to do a poo. The conveyor belt keeps moving, and more poo arrives to join the poo traffic jam. The longer the poo sits there, the more water is absorbed, and the poo becomes hard and dry and stuck. The proper name for a poo traffic jam is, of course, constipation. It occurs very easily, and once the poo has built up, no more messages are being sent to the brain, and we don't even know it's there. New poo is being made all the time. Sometimes the liquidy sloppy poo in the ascending colon gets squeezed along and bypasses the stuck poo. That means the child may pass liquid poo, which parents often think is diarrhea. This kind of poo is called overflow.